Thanks very much, Derek. So we had two speakers who gave us a lot of rich data, statistics, and even potential metrics for us to consider. We are running a little bit behind schedule, but we are going to take the time for 2 or 3 questions. So, Dr. Dodd, if I can ask you to come back up. So we have one person in the center room. And again, if you can identify yourself and your affiliation, that would be great.
My name is Barbara Lowe Fisher. I'm with the nonprofit National Vaccine Information Center. 23,000 infants die before their first birthday in the U.S. every year, with half of those deaths occurring on the first day of life. And women giving birth today in the U.S. have more than twice the risk of dying during pregnancy, childbirth, or within 1 year of giving birth, which is the worst infant and mortality rate, maternal mortality rate among developed countries. While 1 child in 6 in America is learning disabled, 1 in 9 has asthma, 1 in 45 develops autism, and 1 in 400 has diabetes, and millions more suffer with other chronic inflammatory disorders. A shared value is preventing this new chronic child disease and disability epidemic from getting worse. How can corporations work with governments to address this growing public health problem?
Derek, would you like to take that one?
Oh, lovely. Well, I would just say that I think the core issue in that particular health concern is less about shared value in the way that Mark Kramer and I were talking, and more about a failure of government. And I think that that is something that you need to really double down on, and all of us need to double down through the political process in this country, because the discrepancies between infant and child health mortality in the U.S. and Europe are, I'd say, less a shared value issue than a political decision about how much money, resources, and support are given to the public health sector. And I know we have in the room Jessica, who may want to speak to the fact that the CDC budget, for example, is pathetically small compared to what it should be, or many of the basic public health investments in institutions are too small. The shared value actually aspect would be for the corporate sector to speak up strongly and boldly and lobby as strongly as it does for its own policies as it should for a stronger public health infrastructure to address these very basic issues that are so well addressed in so many of the other OECD countries, but still fail in this country.
Thanks, Derek. Any other questions? And I'm a little vertically challenged, so if I don't see you, wave your 10 card. Dick.
Dick Garant at the University of Virginia Center for Global Health. Derek, I think your point about verification is so terribly important, especially taking Ali's data into consideration, and the importance that Mark raised of listening to our customers and learning from them, I think raises the tremendous importance of the long-term perspective and of education or marketing, if those are similar, because it is in fact an important long-term and educational process that needs to take place with both directions. We not only need to learn from our customers, but our customers might have heard the educational lesson that smoking is something they desire, or sugary drinks. So there is clearly a dialogue that's important, and the importance, I think, of education or marketing, our whole concepts of what is value is something that also needs our attention. I know it's something that Rajesh has talked about with his children's health program, but don't know if there are comments on that.
And I would just make one very brief comment, and that is that I think in the same way we have seen the population consumer groups rise up and really, I think, lead the way to us having stronger focus of environment, on climate change, on many of the governance and diversity issues that haven't actually been addressed so well in the last few decades. The same is happening with regard to health. If you look at every single trend out there, it seems that there's a steady groundswell across almost all countries of people on the ground demanding access to healthier services and healthier products. That is going to be one of the best assurances that you will end up having a close partnership between the consumer bases and the investment class. Because in the end, those sitting in a large asset management company are going to be aware that a company can only sell what people are willing to demand and buy. And if demand is moving increasingly towards health and everything we can do to help it goes in that direction, that is good for society and it's good for the companies who are going to reap the benefits of it going in that direction.
So I didn't want to dodge the question about maternal mortality, but I wanted Derek to take the first shot at it. If you compare us to our peers, Western countries and countries that have money, we're failing as a U.S., I'm talking right now, we're failing on all the indicators, not only maternal mortality and infant mortality. And then we in the U.S. spend more money than anybody else. And that shouldn't be the issue, that we're spending more money. If one person has more money than the other one, his house, his car, her house, her car would be more expensive than the other one. That's okay to spend more money if you have more money. Then the question comes, are you getting the return on your investment? And that's where the debate should be in the United States. Clearly, we're not. With all the money we spend, we're not seeing the success. Why? There are so many factors, and as I discussed these 4 factors in my talk, but we really comes back to prevention and public health in the United States. First, it's not funded comparatively to other countries. Social safety network is not similar to any other country here. We have all the might, but we don't do so. So the example for a woman dying during delivery in the US, which is criminal, what we do at the Global Health, we say, do your 4 or your 5 prenatal care. Any sign of danger have been noticed early on, and you refer to a better medical facility for delivery where we know we could save your lives. And that's one of the indicators we measure right now, skilled birth attendance, where we do it in every country in the world. Well, we don't have that in the US. Even if you have insurance sometimes and you are, unfortunately, in the scale of income, you don't have the time to quit your job. Sometimes your employer wouldn't allow you to do your preventive care. And a pregnant woman needs a lot of time to take off, and then she's debating between earning her income for her family and the rest of her kids, or going and seeing a medical doctor, and she pays a heavy price for it. So there is a lot to be done. The funding for the U.S. government prevention is not adequate, not at the county level, not for any of programs. And we have a long way to do it, and we have a big responsibility to educate our politicians in that regard, where we need to invest more in our safety network and prevention.
So thank you. If everybody could just please join me in thanking our 2 speakers.